What's going on, everybody? Welcome back to my channel. As you guys know, I'm staying indoors, so most of my videos are going to be indoors because you know mama's not going outside. But welcome back to my channel, guys. Today we are going to talk about the top 10 nursing jobs. Top 10. So we're going to discuss that, and I'll see you guys in a bit. Okay, we're back. Okay, so this is something that interested me and what I used to research when I decided I wanted to become a nurse. I know I wanted to specialize in something, I just didn't know kind of what. I had an idea, and this is something like I decided maybe like 5-6 years ago, and I decided what I wanted to specialize was to become a certified registered nurse anesthesiast. And before some of you say, Steph, hold up, wait a minute. Are you sure? Are you sure that's what you want to be? Because I had a lot of nurses and even teachers says that, oh, a lot of students, they go into the program saying, this is what I want to be, this is what I want to be. And then they do clinical rotations and they completely change their mind. They're like, oh, nah, this is not what I want to do. I want to do this. So for many of you, if you guys are just starting your clinical rotations or have not yet, you will realize that you ended up loving something that you completely thought you weren't gonna love. And it happens a lot. As far as me, because I work in the hospital and I was able to float different units, I kind of had a feel of what each of the nurses do in their units. And I realized that this is what I want to do. One, I do want to work with kids, so I do want to work in order to become a nurse and anesthesiologist, you have to work in the ICU for about 2 years, any ICU. So I want to work with kids, so I do want to work in the PICU. PICU is Pediatric Intensive Care Unit, or the NICU, which is Neonatal Intensive Care Unit, where you're dealing with newborn babies. So that definitely is close to my heart, and I absolutely want to do that. And then become a nurse anesthesiast and, you know, go on my merry way into my life. So today we are going to discuss the 10 highest paid nursing jobs. I got my little handy dandy computer. Say Snoopy, what's up, dog? Little Snoop. We're going to go from 10 to number 1. And then I'll explain to you kind of their primary duties. So my face is going to be going this back and forth so I can kind of read off. This information is coming from Indeed. It was posted January 25th, 2019. If you guys want to know, if you search this, you'll pretty much get the same information. This is going to be the same top 10. And yeah, so let's begin. So number 10 is clinical nurse educator. Their national average salary is $101 per year, which is $101,000. It's a 6-figure salary. Their primary duties is clinical nurse educators, also called nursing professional development specialists, are responsible for training nursing professionals with healthcare facilities. They develop training curriculums and oversee new nurses and nursing school students in a clinical setting. They may work with a hospital or educational institution. So basically, for all my people who are doing clinicals, that is your clinical nurse educator. And they're on the top 10 of getting paid. So if you like teaching and you learn that, hey, I kind of like what she's doing and I like teaching other people, maybe this is the job for you. Now, mind you, I didn't go into nursing because of the pay, and I'm not choosing nurse anesthesiologist because of the pay, although it helps a little bit. You make sure with whatever that you choose, you absolutely love doing it. You hear me? Absolutely love it. Love what you do. Don't just join something because of the money, although the money helps, but don't join something because of the money. I'm just letting you guys know the top 10. Okay? Moving on to the next one. Number 9 is nursing home administrator, and they make around the same amount as a clinical nurse educator, maybe like a couple dollars more. They said it's $101 to $55 per year national average salary. Their primary duties, administrator is someone who combines experience in education and healthcare with business skills to supervise and manage administrative and clinical activities within nursing home facilities. They may be responsible for hiring and training staff, handling the budget and other financial matters, and assisting in patient care as needed. So this is, mind you, I'm reading this from Indeed, so if you guys want to find out more information, feel free to, I'm going to actually add the link below, because in this link you can press it and I think it gives you more information of that specific specialty. So moving on to number 8, family nurse practitioner, which most of you guys kind of know. A lot of people do go in this area. Primary duties: family nurse practitioners deliver family-focused care. They help patients by diagnosing and treating acute and chronic illnesses in patients from childhood through adulthood. They often conduct and review diagnostic tests, prescribe medications and treatment plans, and consult with patients and their families. 7 is an advanced practice registered nurse. An advanced practice registered nurse, which is APRN. Get familiar with the abbreviations. Registered nurse, RN. CRNA, certified registered nurse anesthesiologist. CNA, certified nurse and certified nurse assistant. Sorry, rambling on. But remember, know your abbreviations, because when you see that, you're going to be seeing a lot of abbreviations in the hospital and people's positions. An APRN is an advanced practice registered nurse, and they fall in 10, 9, 8, number 7 in the top 10. Primary duties: an APRN is an RN who has pursued advanced training in a specialized area. They may work as nurse practitioners, nurse anesthesiast, clinical nurse specialists, nurse midwives, or other advanced roles. APRNs are authorized to diagnose patients, prescribe medication, and develop patient care plans. Boom. That's number 7. So that is your APRN. Number 6 is medical surgical nurse manager. Their primary duties: medical surgical nurse managers are responsible for providing direction and administrative oversight to medical surgical care teams, and plan and lead nursing care within a hospital setting. They may oversee staffing and training of more junior healthcare employees, such as registered nurses, monitor and respond to changes in patient volume, and ensure care team adheres to all hospital policies and procedures. That's number 6. Number 5. Am I right? That's 6. Let's see. 10, 9, 8, 7, 6. That is number 6. Number 5 is your regular nurse practitioner. So a nurse practitioner is a healthcare professional who assists in nearly every aspect of patient care, including conducting, interpreting diagnostic tests such as x-rays and lab work, diagnosing conditions, creating treatment plans, and consulting with patients and their family. They may work as part of a clinic or hospital treatment team, or independently as part of a private practice. Now, many people are saying, didn't you already say nurse practitioner? I said earlier, I said family nurse practitioner. So mind you, there are different specialties, so realize that when you're going into something that it may pay a little different, but it is being a nurse practitioner is one of the top 10s. So that's number 5. Number 4 is pain management nurse. Primary duties: pain management nurses often work within hospital oncology units, palliative care or hospice programs to help identify the cause of a patient's pain and assist in preparing a care plan. They may also work as advocates to help obtain the patient's medication, or as liaisons for vocational programs to help patients manage pain while returning to work. So that's number 5, 4, 3, 2. I mean 4. That's number 4. Number 4. And then number 3, psychiatric nurse practitioners. Their primary duties is psychiatric nurse practitioners, also called mental health nurse practitioners, are APRNs, remember the abbreviation, who evaluate patients to diagnose mental illnesses, assist in treatment planning, and prescribe medication. They also work to educate patients and their families about their mental illness, diagnosis, and treatment options. They may work as part of a hospital's mental health unit or for an independent practice. That is number 3. That's number 3. Number 2, a clinical nurse specialist. Clinical nurse specialist is an APRN who cares for patients as part of a variety of healthcare specializations. They typically work with nursing staff and patient care managers to provide education and optimize patient care efforts. They may review and evaluate patient care plans, complete research to find alternatives, and provide recommendations to help improve patient outcomes. So that's number 2. And Dromo, number 1 is a certified registered nurse anesthesiist. Certified registered nurse anesthesiasts are advanced practice registered nurses who deliver anesthesia and pain care services such as epidurals and nerve blocks. They may work with surgeons, anesthesiologists, podiatrists, dentists, and other healthcare professionals to help prepare a patient for a procedure, assist stabilization, and monitor patients during post-operation recovery. So, I've looked up what it is to become a CRNA. It is very intensive. You have to work in the ICU for 2 years. They do say you can work in the ER, but their preferability is ICU, 2 years. It's not that easy, and it's not easy to get into from what I've learned. And once you do get into it, it's no joke. It is a 2-year program, and basically they're like, you can't work during this 2-year program. It's that intensive, but it is all well worth it, and I can't wait to go into that journey. I'm still in my nursing program journey, which is all online right now with everything going on. Hopefully we get back into picking things up again. Hey guys, my camera died. Now I'm back. So that was my top 10 highest paid nursing jobs. Other YouTube, or even if you Google search, they will probably do more of a generalization, but it's pretty much around the same area. I focus more on basically specialties as well, and like family nurse practitioner and regular nurse practitioner, so you guys can kind of know exactly what they specialize in. Those are the top 10. I did get my information from Indeed. It was from 2019. I think that from everything that I Googled, the information is still the same. And you can research as much as you like. I will have links at the bottom so you guys can see what I've seen. If you guys have any questions, feel free to let me know. Anyone going into the nursing career or currently in the nursing program, it's a great way to research. You're going to find out once you're in the program what you really love to do or where you want to focus, specialize. These are part of the top 10. Thank you guys so much for stopping by my channel. Please remember to hit subscribe. Follow me on Instagram and also on TikTok, because now I'm on TikTok and the whole world's on TikTok because of the COVID. But yes, follow me. Let's have some fun together. And thank you guys for stopping by. Bye.